Hello everyone. Today I'm going to discuss a very high yield topic that they are keep asking in May as well as in April. I saw this question as well as earlier. Our topic name is Stronglydiasis, that is intestinal parasites helminths. So let's cover the recall questions. So in May, they are asking a question: a man from a tropical rural region presents with months long intermittent diarrhea, abdominal pain, and an itchy serpiginous rash on buttocks and feet. Lab shows eosinophilia. Okay, this means this rash looks like a snake rash. Snake, snake rash. It's just like snake. It's on your buttocks and in your feet. Okay, so the patient has a tropical rural region presents with months, presents after months means okay, diarrhea, abdominal pain, and itchy rash. Okay, that looks like we call this serpiginous rash on buttocks and feet. Lab shows eosinophilia. Okay, so the option is Stronglydiasis, Crohn's disease, giardiasis, ulcerative colitis, and celiac disease. The rash is larva. The rash, typically this rash type, we called it larva currens. Rapidly moving serpiginous rash, eosinophilia, chronic GI symptoms in endemic areas. We have to think about Stronglydiasis. Okay, patient comes to you with this rash, serpiginous rash. I will show you the rash like how it looks like: intermittent diarrhea and abdominal pain, itchy rash on buttocks and feet, and labs also shows eosinophilia. So then we have to think about the Stronglydiasis, right? Another question in May, they ask about 35-year-old women tracked 2 years ago. 2 years ago, guys, present with loose stools and rash unresponsive to steroids. Okay, then what we're gonna think it? Eczema, definitely no. And mammalian meat allergy, no, because in mammalian meat allergy, it is caused by, like, if somebody has tick bites, okay, tick spots, and then the patient eats something like meaty, something like beef, mutton, fish, pork, they will start developing the rash only on during that time period. Okay, Lyme disease, we will get the history of what you called in Lyme disease we have the history of tick bite. Okay, another thing is in Lyme disease we have the completely a different rash, we called it bull eye rash. Okay, it's completely different rash, but in strangulidosis, remember that we have the rash, our rash looks like larvae currens. Okay, larvae currens, right? And in Lyme disease we have the rash bull eye rash, right? Mammalian meat allergy, it's caused by tick bites, and in that patient has getting the allergy whenever the patient eats beef, mutton, pork, but it also presents after years, after months. Steroids worsen strongyloidosis. Remember that. Risk of hyperinfection syndrome, life-threatening disseminated infection. Never give steroids to the patient who has strongyloidosis. Patients with 3 months diarrhea, history of multiple tick bites. Okay, multiple tick bites. One, we have to think about Lyme disease and strongyloidosis. Use as a distractor. Ticks are not vectors for strongyloidosis. Used in exam to confuse with Lyme mammalian meat allergy. So, always remember the difference. In Lyme disease, we have the history of tick, but always remember that Lyme is not an endemic in Australia. Okay, so 3 months diarrhea is due multiple tick bites. Still, we don't have to think about strongyloidosis. We have to think about both, right? Okay, so the next question is pathognomic rash. What is a classic rash of strongyloidosis infection? Larvae occurrence and larvae migrans. It's in the Lyme disease. Remember, please. Mammalian meat allergy differential. Hiker with diarrhea, skin lesions resembling tick bites. If triggered by red meat ingestion, then definitely it's a mammalian meat allergy. If it's like snake-like serpiginous rash, eosinophilia, strongyloidosis, remember that in what you call strongyloidosis, remember three diseases: Lyme disease, another one is a condition called mammalian meat allergy. In mammalian meat allergy, we have the history of tick, and then in the scenario, you will see that okay, the patient eat meat and then started that allergies, that spots, and we called it bull eye rash. Okay, in Lyme disease, erythema migrans, and larva curans. Very 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 important, as you can see the scenarios as well. Another stand history tracking tropics, barefoot soil, skin larvae currents. In GI, we have chronic diarrhea. In strongyloidosis, in labs, we will see eosinophilia, contraindication, steroids. We will never give steroids. Management is ivermectin. Okay, remember that ivermectin is the management for that. Next scenario is 35-year-old female tracker who tracked 2 years ago present with loose stool and rash that does not respond to steroids. So then we have to think about strongyloidosis. Strongyloids often presents in tracker with chronic intermittent diarrhea and an itchy rash. The source specifically note if it is resistant to steroid. Another scenario is lady who hiked frequently presents with episodes of diarrhea and skin lesions described as tick bites. He has not hiked for a year, but symptoms persist. So yeah, this scenario, these are the recall questions. Remember that. So we don't have the full recall. So whatever we have it, we have to think about in that way. Tick bite in certain regions are uniquely associated with developmental and delay allergy to mammalian beef, lamb, pork, usually GI and skin symptoms. Okay, so of course it's not because we don't have the history of tick bite and then episodes of diarrhea and skin lesions. Okay, so yeah, this is the clue. So tick bite in certain regions are uniquely associated with development of delay allergy to mammalian bite. Okay, so the patient has the rash and then the patient comes to yes, like whenever the person eat beef, lamb, pork, doctor, I get that rash. So think about that mammalian meat allergy. Another scenario is a patient presents with 3 month history of diarrhea and notes multiple ticks were previously found attached to the body. So what is that 3 month history of diarrhea? And Lyme disease will present in a very different way. We will read the Lyme disease as well. So we have strongyloids, correct answer. While the tick is not vector of strongyloids, which is soil transmitted, this recall is often used to test the clinician ability to prioritize endemic parasite infection over Lyme disease, okay, in the Australian setting, right? The next question is that what is the classic rash? As we already discussed, it's a repetition. Okay, the patient involves diarrhea, serpiginous rash, strongyloids. If the symptoms involve diarrhea after eating meat, look for mammalian meats allergy, right? If the question asks about target shaped rash, always think about erythema multiforme, not a Lyme disease, right? But if the patient has bull eye rash, then definitely you have to think about the what you call Lyme disease. Okay. Next scenario is that a patient presents with 3 months history of diarrhea. Upon examination, multiple ticks are found attached to the body. That is strong glides, right? Okay. Women who frequently hikes complains of episode of diarrhea and skin lesions that look like ticks bite. So definitely, uh, though she did not see the ticks, he has not hiked for a year, but still he has that. So you might get the mammalian meat allergy, alpha gel syndrome. Tick bites in certain regions are uniquely associated with the development of delayed allergy to mammalian meat, beef, lamb, pork, causing these symptoms, right? So please remember that high yield point. A hacker or tracker developed insect bite like lions that resolved. Okay, they are now presenting with abdominal pain and diarrhea. We will go with the insect bite, like look like an insect, like strongyloids. Okay, what is the classic right description of strongyloids infection? Larva curians. Okay, and erythema migrans in the Lyme disease. Okay. What is the classic rash of strongyloids infection? Larva curians. What is erythema migrans? We will see in the Lyme disease. Tracking outdoor exposure and ticks. Strongyloids very itchy. Larva curians very itchy. Rapidly moving, usually buttocks, thighs, and trunks associated with diarrhea is eosinophilia. Front is moving, strongyloids, larva currents. Lyme disease, erythema migrans. Okay, and the expanding red ring, bull-eye experience at site of tick bite, not serpiginous, not rapidly moving. Okay, so it's early migrants. We will see the early migrants in that. Bull-eyes at site of tick bite, larvae migrant, the larva, this is cutaneous larva migrants, usually in the dog and hookworm. Its serpiginous tract in skin, usually feet after walking barefoot on beach. Skin disease only, no chronic diarrhea, no eosinophilia pattern, treated like strongyloids. Okay. So in Lyme disease, we don't have diarrhea. Most important thing. Chronic diarrhea, eosinophilia, tropical travel, itchy rash, strongyloids. Okay. Larva curins is the name of the rash. Okay, erythema rash, bull eyes, larvae currents in other one. GI symptoms not typical, intermittent diarrhea and pain, tick prone area, Lyme disease, and trekking, hiking, sore contact, Broly's serology, and eosinophilia in that case. So I just attach this table. If you want to go through that table, you can. Please, okay. Okay. So what are the clinical features? In clinical features, watery diarrhea, excessive mucoid abdominal pain, crampy pain, nausea, vomiting, weight loss, pruritus, ani, and bloating, right? Immunocompetent patient, what is the other symptoms? Asymptomatic, no signs of symptoms, 50% of patient. Acute stronglydiasis, parasite penetrates skin, parasite migrate to skin, cutaneous sarcoidosis, larvae currents. 90% those with stronglydiasis will have larvae currents. Dermatological finding, articular rash, we call it ground itch, intense pruritus, papillovesicular. Okay, immunocompetent, symptomatic pulmonary strongyloidosis, 10% of patients affected. Patient comes to us with a complaint of cough, dyspnea, wheezing, and fever. Eosinophilia, we call it flare-like syndrome, pneumonitis, migratory pulmonary infiltrate as well. Chronic strongyloidosis presents with the signs and symptoms occurring for many years, and eosinophilia is also there. Okay, in immunocompromised patient, how you manage? Severe presentation GI, respiratory, dermatology symptoms. Fever is always present. Bacteremia, septicemia, E. coli, Klebsiella. Okay. Respiratory manifestation include hemoptysis, pulmonary effusion, pruritic pain, severe dyspnea, ARDS. And GI manifestation includes ileus, small bowel dilatation, strictures, ulcerations, and GI bleeding, bloody diarrhea. Okay. Understand so far? Okay. Diagnosis, for how we diagnose a patient. Very important in patient who are going to start immunosuppressive treatment even if exposed to risk factors decades earlier. Eradication of organism prior to initiating immunosuppressiveness is very important. Remember that point. Stool, ova, and parasite found in stool more than 1 month after initial skin infection. Several stool samples may be needed more than 3 consecutive days, especially important in CS. Okay. Eosinophilia we can see in acute infection not present in severe and immunocompromised people. Anemia, thrombocytopenia, elevated PTT, APTT, INR, we can expect that. Chest X-ray shows patchy alveolar infiltrates, segmental and diffuse infiltrates, pleural effusion, bronchopneumonia, and CT scan, we have that. Prevention, how we can protect it? Wear protective shoe wear in endemic areas, for example walking on beach and soil. Improve sanitation, close monitoring and evaluation of individuals from high prevalence area. Okay, so this is a mammalian meat allergy that I already told you. Another name is alpha gal or alpha gel. Mammalian meat allergy is a relatively recently recognized phenomena in which the tick venom causes sensitization to an allergen known as alpha gel. The prevalence of mammalian meat allergy is uncertain. Symptoms often do not start for several months after the tick bite. They may present allergy of varying severity, anaphylaxis, angioedema, Generally 3 to 6 hours after ingestion, meat, milk, and other products containing alpha gel, gelatin, coated medication, consider the possibility of mammalian meat. Management of includes education of the patients about the advanced avoidance of alpha gel in the mammalian meat as gelatin containing foods and medications and blood substitutes. Okay, that is Lyme disease, and that is what you call, like, the, like, insect serpentinius, and it's a Lyme disease called erythema target sign. Okay, these guidelines I took it from therapeutic guidelines, therapeutic wording. Okay, tropical rural exposure, strongyloidosis, chronic diarrhea, eosinophilia, serpiginous rash, strongyloidosis. Investigation, we will do stool testing, 3 fresh stool samples. Why 3? Because larvae shed intermittently and single stool samples may be negative. Suspected chronic strongyloidosis, send 3 samples for microscopic culture and PCR. So the initial test is stool testing. Eosinophilia common in the chronic infection. The patient on steroids may have disseminated strongyloids with the normal eosinophilia cold. Then we will go with the strongyloids IgG. Diagnosis, follow-up, treatment. Hyperinfection syndrome, if suspect, is sputum microscopy for larvae and chest X-ray. We have to perform that. Management, ivermectin. Uncomplicated cases, we will do the single dose. Repeat after 7 to 14 days. Answer, ivermectin. Albendazole is alternative, unavailable or unsuitable. If ivermectin unavailable and unsuitable, less effective. Hyperinfection syndrome is triggered by corticosteroids. Practice from more than 20 mg per day for 2 weeks. Okay, this is leads to hyperinfection. Steroids at risk patients, steroids, organ transplant, chemotherapy, hematological, HTLV1 virus, and advanced HIV. Presentation, patient with known and diagnosed strangulars develops severe diarrhea, dyspnea, wheeze, sepsis, gram-negative bacterium. Think strongyloids, hyperinfection syndrome. Always, always, always. Treatment of hyperinfection, ivermectin daily. Symptoms resolved and stool sample negative for larva. Okay. Secondary bacteria infection, strongyloids carries gut bacteria into bloodstream. Therefore, we will do the blood culture, empirical IV therapy, ceftriaxone. A patient has chronic diarrhea, eosinophilia, larva occurrence, strongyloidosis. The 3 stool sample for microscopy PCR. Best investigation is 3 stool sample for microscopic PCR. Question, best treatment, ivermectin. A patient with chronic strongylitis is started on prednisolone and develops respiratory failure and septic. What happened? Because of the hyperinfection syndrome, right? Chronic diarrhea, eosinophilia, curins, stool sample, strongyloids, IgG. It's confirmed that is strongyloidosis. Treatment, ivermectin first line, albendazole alternative. Hyperinfection triggered by steroids. Stool sample larva, daily ivermectin. Add antibiotic for negative sepsis. So one later, remember that strongylides, diarrhea, eosinophilia, larva occurrence, ivermectin. Never forget steroids can cause fatal hyperinfection. That is all about this topic. We don't have emergency questions. So these are the topics. This topic covers all the important things which you guys need to memorize it.